Gum disease is one of the most common oral diseases that we dentists see. Fortunately, it's completely preventable. So I wanted to give you some background into what causes it, but then 5 simple steps that you can do today to stop the chance of you getting it or from it getting worse. A quick background, and I'm going to use this image to help us.
I just want to pause the video just so I can explain this image first, and to do that I'm going to use an actual photo from a patient of mine. Basically you have the gum sitting over the top of the tooth, and in the cartoon version how that is represented is you have the gum on the outside, then on the inside you have the tooth and the tooth root, which is actually sitting inside the bone. Okay, we'll continue.
Where the tooth meets the gum, there's actually a gap at that point. We call this gap a pocket. Now inside this pocket lives bacteria, lives food, and also plaque. Now because the bacteria are always inside that pocket, whenever there's plaque there, they actually break it down and turn it into harmful chemicals that cause gum disease. Now the bad thing is that over time, this plaque actually hardens and turns into like this concrete-like material called calculus or tartar that can only be removed by a dental professional. So how does it affect the body? Well, the first reaction to the plaque and calculus is inflammation. Now this is noticed as bleeding from the gums while you're brushing or you're flossing your teeth. Now this will actually resolve once that plaque and calculus has effectively been removed and the body can heal itself. However, if it's not removed, this inflammation will actually lead to destruction of the underlying bony structures. The problem is that as the bone starts to break down, the pocket that I was talking about before actually gets deeper and it gets bigger. That actually is worse because that means that more plaque, more bacteria, more food can collect inside, it becomes harder to clean, and the effect just snowballs and becomes a lot worse. Eventually, as the bone continues to slip down, the tooth becomes infected, it becomes wobbly, and we have to take it out. An analogy I like to use is the pocket around the tooth and the gum is like a collar on your shirt. Hey, just a thought while you're watching. If you're getting something out of the video, hit the like button or hit the subscribe button. It really helps me out a lot. When it's nice and healthy, it's really tight and it's not easy for plaque and food to get stuck in there. When it becomes inflamed, it becomes a bit looser and more can go inside, it becomes a little bit harder to clean. Over time, as the inflammation builds up and the bone starts to shrink away, it actually becomes a lot deeper, really hard to clean, and you have to be coming in every 3 months to get it actually professionally removed. We want to try and avoid this as much as possible. So now that we understand it, how do we prevent it or slow it from getting worse? Well, the simple answer is as long as there's no plaque there, the bacteria can't make those harmful chemicals, so we have to get rid of the plaque. Now this means effectively brushing your teeth for at least 2 to 3 minutes every single day, as well as cleaning in between the teeth. So I'll cover this in more detail in another video and I'll link that here eventually. But basically to brush really effectively, we need to angle the brush at 45 degrees so the fibers actually get inside that pocket that we were talking about and effectively remove that plaque. Now to clean between the teeth, I don't really care what you use. You can use floss, Pixters, water floss, toothpicks if you have to, but we need to get rid of the plaque that is in between the teeth. The problem is that any lapse in that cleaning, the plaque will solidify, it'll turn into calculus, more plaque will build up on top of that, and again, that snowball continues. So we want to prevent that from happening. So unfortunately, no matter how well you're cleaning, 99.9% of the time, that calculus does eventually form. So regular visits to the dentist to remove that hardened concrete calculus is really, really important. Otherwise, what happens is the inflammation is constantly there, eventually the bone will start to shrink away. So for those that already have the bone loss and a more severe gum disease, we really want to make sure that it doesn't get any worse. So more regular visits, say every 3 months, might be more appropriate. So another thing that you can do, especially for those that already have gum disease like we just spoke about, you can use a mouthwash that contains chlorhexidine. Chlorhexidine is basically a molecule that actually kills the bacteria that are associated with the cause of gum disease. So in Australia, the 2 main ones that we have are Savicol and Curacept. Both are really great products. One thing I will say, Savicol, it's a little bit more affordable, however it does stain the teeth. So if you use it for more than 2 weeks, eventually you notice some brown staining on the teeth. So use it 2 weeks on and then have a break and then do 2 weeks again. With the Curacept, it's a bit more expensive, but it's actually non-staining. So you can use it for 4 weeks in a row and then you can have 1 week off, 4 weeks, 1 week. So to use this effectively, use it for 1 minute, swishing it around the mouth. But the key is don't use it within an hour from brushing your teeth. The problem is that the toothpaste actually stops that chlorhexidine from working. So what I recommend is using it for a minute in the afternoon, really effective way to kill that bacteria. Now for those that have gum disease in specific sites, like around the back teeth or you've got implants, what you can do is you can actually pour some on your toothbrush and brush really effectively around those teeth, or on your little interdental brush and put it between the teeth as well. That's a great way of doing it. I do have links in the descriptions on where you can purchase those. In America they have some different names, but I've got some links in there for you to look at that as well. And the last thing I want to talk about is smoking, because it plays a huge role in gum disease. The problem is that the body can't actually respond to the bacteria that cause the gum disease, and it progresses at a really fast rate. So for anyone that is worried about gum disease, or you think that you might have it or it might get worse, if you're thinking about quitting, now is an amazing time to do it, or at least cutting down how many smoke you do have every day. So to summarize, we need to get rid of that yucky plaque, which means brushing the teeth twice a day. We need to use something to clean in between the teeth, at least once a day. We need regular dental visits and cleans. We need to use a chlorhexidine containing mouthwash. And for those that smoke, please quit. Help the body respond to the bacteria. So if you can do these 5 steps, the chance of you getting gum disease will drop, or if you already have it, you're going to definitely slow down its progression. As always, thanks heaps for watching the video. If you got anything out of it, please like and subscribe. It means a lot to me. If you think anyone that you know will benefit from it, please share it with them. If you got questions, comments, feedback, whatever, put it in the comments section or send me an email. And remember, keep on smiling.